Welcome back to Health 999. Today, we're talking about something that affects millions of older adults, bone health. If you or your loved ones are over 60, this video could be life-changing. Let's explore how to strengthen bones and prevent osteoporosis, the silent bone disease. 1. What is osteoporosis? Osteoporosis is often called a silent disease, and for good reason. It develops slowly, over many years, and usually shows no symptoms until a bone actually breaks. But what exactly is it? The word osteoporosis literally means porous bones. Inside healthy bones, there's a honeycomb-like structure, strong, yet slightly flexible. But in someone with osteoporosis, those honeycomb spaces become much larger, causing bones to become weak, thin, and more likely to fracture, even from a small fall or a minor bump. Think of it like this. A strong bone is like a sturdy oak branch. A bone with osteoporosis, it's more like a dry twig. One wrong move and it can snap. So who gets it? While osteoporosis can affect both men and women, it's especially common in older women, particularly after menopause. In fact, according to the National Osteoporosis Foundation, 1 in 2 women and up to 1 in 4 men over the age of 50 will break a bone due to osteoporosis. Why does this happen? As we age, our bodies naturally lose bone mass. In younger years, our bones rebuild themselves constantly, breaking down old bone and forming new. But after around age 30, bone building slows down. By the time we reach our 50s or 60s, bone loss outpaces bone growth, and that's when osteoporosis can begin to develop. Some of the main risk factors include being over 65, having a family history of osteoporosis, being underweight or having low body mass, smoking or heavy alcohol use, not getting enough calcium or vitamin D, being inactive or sedentary. But here's the tricky part. You can't feel your bones getting weaker. There are no early warning signs, no pain, no swelling, nothing obvious. The first sign for many people is a fracture, often in the hip, spine, or wrist, after a minor fall or even just bending over or coughing. And spinal fractures can be especially dangerous. They can cause loss of height, stooped posture, and chronic back pain. In severe cases, osteoporosis can even lead to disability or loss of independence in older adults. But the good news is, osteoporosis is not inevitable. There are powerful evidence-based ways to prevent, slow down, and even reverse some bone loss. The earlier we understand the risks, the better we can protect ourselves and our loved ones. In the next sections, we'll explore exactly what you can do, through nutrition, movement, lifestyle, and prevention, to keep your bones strong and your body resilient as you age. 2. Nutrition for strong bones. When it comes to building and maintaining strong bones, nutrition is everything. Think of your bones as a living bank account. Every day, you either make deposits or withdrawals, and the foods you choose play a huge role in that balance. The 2 key players for strong bones are calcium and vitamin D, but there are also a few supporting nutrients that many people overlook. Let's start with calcium. Calcium is the most abundant mineral in the body, and over 99% of it is stored in your bones and teeth. As we age, our ability to absorb calcium naturally decreases, especially after age 50. That's why it's so important to increase calcium-rich foods in your daily diet. Some of the best sources of calcium include dairy products like milk, yogurt, and cheese, especially low-fat versions, which are heart-healthy as well. Dark leafy greens such as kale, bok choy, turnip greens, and collard greens. Fortified foods like orange juice, almond milk, soy milk, or breakfast cereals with added calcium. Canned fish like salmon and sardines, especially when the bones are soft and edible. But here's something many people don't realize. Even if you eat plenty of calcium, your body can't absorb it well without enough vitamin D. So let's talk about vitamin D. Vitamin D helps your intestines absorb calcium efficiently. Without it, calcium just passes through your system unused. You can get vitamin D in 3 main ways. Sunlight. Just 10 to 20 minutes of sun exposure on your skin a few times a week can help your body produce its own vitamin D. Foods. Fatty fish like salmon, mackerel, and tuna are great sources. You'll also find vitamin D in egg yolks and fortified dairy and cereal products. Supplements. For many older adults, Especially those who live in colder climates or spend little time outside, a daily supplement of vitamin D3 may be necessary. Most experts recommend between 800 and 2000 IU per day, but check with your doctor first. And we can't forget magnesium, vitamin K2, and protein, all of which support bone health. Magnesium helps activate vitamin D and is found in foods like nuts, seeds, whole grains, and beans. Vitamin K2 helps guide calcium into the bones rather than letting it settle in the arteries. Protein is essential for building bone matrix, the structure that calcium sticks to. Good sources include eggs, beans, lean meat, and tofu. Also, hydration matters more than you think. Bones are about 25% water, so drinking enough fluids helps keep joints and bones healthy and flexible. In summary, a well-balanced diet rich in calcium, vitamin D, protein, and supporting nutrients can truly make a difference in maintaining bone strength, especially in your golden years. It's never too late to nourish your bones. 3. Exercise is key. When it comes to bone health, exercise isn't just good, it's essential. Just like muscles, bones become stronger when we use them. And as we age, physical activity becomes one of the most powerful tools we have to maintain bone density and prevent fractures. But not all exercises are equal when it comes to bones. The most effective ones fall into two categories: weight-bearing exercises and resistance training. Weight-bearing exercises are activities where you move your body against gravity while staying upright. This includes walking, brisk walking, hiking, dancing, stair climbing, low-impact aerobics. Even gardening or walking the dog counts. These movements put gentle stress on your bones, which encourages them to grow stronger over time. If you're new to exercising, start slow. A 15-minute walk every day is a great beginning. Over time, work your way up to 30 to 45 minutes, 5 times a week. And don't worry, it's never too late to start. Studies show that even people in their 80s and 90s can improve their bone health with regular movement. The second type is resistance training, also known as strength training. This involves using weights, resistance bands, or even your own body weight to build muscle, and in turn, strengthen bones. Why does this help? Because your muscles and bones are connected. When muscles contract, they tug on the bones, and bones respond by increasing density and strength. Here are some simple strength exercises for seniors. Lifting light hand weights. Wall push-ups. Leg lifts while seated or standing. Resistance band stretches. Chair squats. These can be done at home or with a trainer, and should be performed 2 to 3 times per week, with a rest day in between. And don't forget about balance and flexibility exercises, which don't directly build bones, but play a huge role in preventing falls. Activities like Tai Chi, yoga, and gentle stretching improve posture, coordination, and body awareness, all crucial for staying upright and steady. Always remember, before starting any exercise program, it's important to consult your doctor or a physical therapist, especially if you have existing health conditions, limited mobility, or have already experienced fractures. The key is consistency. You don't need to run marathons or lift heavy weights. Just move regularly, stay active, and listen to your body. Strong bones begin with small, daily steps. And the best time to start is today. 4. Lifestyle habits to avoid. When it comes to protecting our bones, what we do every day matters just as much as what we eat or how we exercise. Many people unknowingly follow habits that slowly weaken their bones over time. Let's take a closer look at some of the most common lifestyle habits that can harm bone health, and what you can do to change them. Smoking. Smoking isn't just bad for your lungs and heart, it's also terrible for your bones. Nicotine and other chemicals in cigarettes interfere with your body's ability to absorb calcium and produce bone-forming cells. Smokers also tend to have lower levels of estrogen and testosterone, both of which are important for maintaining bone density. Studies have shown that long-term smokers are more likely to suffer from hip fractures and spinal issues as they age. The good news: it's never too late to quit. Even stopping in your 60s or 70s can slow down bone loss and reduce the risk of fractures in the future. Excessive alcohol consumption. A glass of wine now and then might be fine, but too much alcohol can weaken bones by interfering with calcium balance and harming bone-building cells. Heavy drinkers are more likely to suffer falls and injuries, too, doubling the danger. Doctors recommend no more than 1 drink per day for women and 2 for men. If you're already at risk for osteoporosis, cutting back is one of the best steps you can take. A sedentary lifestyle. Spending too much time sitting or lying down without movement can cause bones to weaken over time. Your bones are living tissue. They respond to stress and motion. Without regular movement, especially weight-bearing movement, bones start to lose density. Watching TV for hours, staying in bed too long, or not going for daily walks might seem harmless. But over time, it increases the risk of osteoporosis and falls. Make it a habit to get up and stretch every hour, take short walks, or even do simple chair exercises throughout the day. Diets high in sodium and soft drinks. Too much salt in your diet can lead to calcium loss through the urine. When calcium leaves the body faster than it's absorbed, bones suffer. Common culprits: processed foods, canned soups, fast food, and salty snacks. Another hidden danger: soda. Many soft drinks, especially colas, contain phosphoric acid, which may disrupt your calcium-phosphorus balance. Plus, people who drink soda often drink less milk or calcium-rich beverages. Cutting back on salt and replacing sodas with water, milk, or fortified juices can help protect your bones over time. Skipping regular checkups. Bone loss happens slowly and silently. If you never check your bone density, you may not realize you're at risk until a fracture occurs. Ask your doctor about a DEXA scan, especially if you're over 65 or have risk factors like family history, low body weight, or past fractures. Regular screenings can help detect early signs of bone thinning, giving you time to take action. In short, small habits can have a big impact, for better or worse. By quitting smoking, limiting alcohol, staying active, and being mindful of your diet and medical care, you're already taking strong steps toward a healthier future. 5. Fall prevention. Even if your bones are strong, one bad fall can lead to a serious fracture, especially in older adults. In fact, falls are the leading cause of injury-related hospital visits among seniors in the United States. That's why preventing falls is just as important as strengthening your bones. So how do we reduce the risk? Let's start with your environment, your home. Take a walk around your house and ask yourself, are there loose rugs on the floor? Are the hallways well lit at night? Is there clutter on the stairs? Simple changes can make your home much safer. Remove loose rugs or use non-slip backing. Install nightlights in the bathroom, hallways, and bedroom. Use non-slip mats in the shower and tub. Keep electrical cords out of walkways. Secure handrails on both sides of the staircase. In the bathroom, add grab bars near the toilet and in the shower. Next, let's talk about footwear. Wearing slippers that are too loose or socks without grip can be dangerous. Instead, wear sturdy shoes with good traction and a non-slip sole, even at home. Another key element in fall prevention is balance and strength. As we age, our muscles naturally weaken, and our sense of balance can decline. But with the right exercises, we can fight back. Try balance-building routines like Tai Chi, which is gentle but powerful in improving stability. Yoga, especially for seniors. Standing on one foot, holding onto a chair. Heel-to-toe walking across a room. Or even slow side steps along a hallway. Doing just 10 to 15 minutes of balance exercises a day can dramatically reduce fall risk. Also, don't forget vision and hearing. Have your eyes and ears checked regularly. Poor vision or hearing can throw off your balance or cause you to misjudge distances. And finally, review your medications with your doctor. Some prescriptions, especially sleeping pills, blood pressure meds, or antidepressants, can cause dizziness or drowsiness, increasing your risk of falling. Don't stop taking any medication on your own, but do ask your doctor if adjustments are needed. Fall prevention is about being proactive. By making your environment safer, strengthening your body, and staying mindful of your health, you protect yourself from serious injury and preserve your freedom and independence. Because every step you take safely is a step toward a healthier, more confident life. Strong bones mean greater independence, fewer fractures, and a better quality of life as we age. Start today. Eat right, move your body, and talk to your doctor about your bone health. If you found this video helpful, please give it a like, subscribe to Health 999, and share it with someone who needs this message. Take care and stay strong.